Hello, my name's Claire Adams and I work as a respiratory nurse in Tees Valley. I wanted to take the opportunity in this very short video to talk to you about your recovery from COVID-19, what to expect, how you can help yourself and where to find useful information, and when you should think about seeking further support from healthcare professionals. Many people following a mild case of COVID-19 infection will report a quick recovery. We know that around 1 in 10 patients, though, will have prolonged symptoms extending past 3 weeks and lasting for several weeks or even months, especially if they've had more serious symptoms or their infection resulted in a hospital admission. These symptoms may include a range of issues, including chronic fatigue, shortness of breath, cough, rashes, muscle aches and weakness, chest pain, headaches, memory problems, and low mood or anxiety. If you are concerned or feel like your symptoms are deteriorating, you should seek medical advice. It may take around 6 to 8 weeks before you start to feel more like your normal self. After looking at the self-help advice and information that I'm about to tell you about today, and if you still feel concerned about your symptoms, then you should think about speaking to your GP. GPs are reviewing patients by telephone due to the ongoing issues and risks with coronavirus, but if during the phone call your GP thinks it's appropriate to see you, they will arrange this. It's very important to seek more urgent help if you have worsening shortness of breath, new chest pain, develop confusion, or if you develop a new weakness of a limb or your face. If your symptoms are persisting beyond 12 weeks, you may require further assessment or tests. Some patients, particularly if admitted to hospital for their COVID, may require a follow-up in specialist clinics and will have a chest x-ray and sometimes a scan. But this does not apply to many patients, as most people have been able to stay at home during their illness. There are lots of things you can do to help your own recovery. It's very important to listen to your own body, try to stay active, but pace yourself. Give yourself permission to do less than you normally would do. It's important to try and accept that you will not return to your usual fitness levels for several weeks. Eating a nutritious, balanced diet and avoiding junk food, limiting caffeine and alcohol will all help, and you'll find really good tips on Eat Well NHS website. If you're a smoker, it's never been a more important time to seriously consider stopping smoking. NHS websites have lots of information on practical support with this, but locally support is available, and if you have any further queries after looking through our Tees Valley recovery literature, you can ask your GP practice receptionist or practice nurse for more information on support with quitting. The NHS has published a website called Your COVID Recovery. This has excellent information on how you can help yourself during your recovery process. Tees Valley have also produced local leaflets which are available on our website, but also from your GP practice. You can also help by obtaining a machine called a pulse oximeter to monitor your oxygen levels. They are readily available via online retailers. Checking your oxygen levels during your recovery on a daily basis can help detect deterioration in your symptoms, and levels which are persistently 95% or below should be discussed with a healthcare professional. If you have a long-term condition such as diabetes, asthma, COPD, heart disease or mental health issues, it's also never been a more important time to manage these conditions well. So if after contracting COVID-19 you feel as though your chronic condition is more affected, then please do get in touch and arrange an appointment with your practice nurse, or if you're concerned that your condition is more serious, make an appointment with your GP. Understanding more about your long-term condition and becoming more of an expert in it can really help you take control of it. And there are several websites such as Diabetes UK, Asthma UK, British Lung Foundation, British Heart Foundation and Mind. All of these have extremely useful information to empower you and help you to manage whatever condition you have well. Do take good care of yourself, continue to follow government advice, and do come forward when you are called for your COVID vaccination. Please don't contact your GP surgery, as you will be notified when the time is right for your vaccination. Thank you for listening.